What are healthy diet tips for stroke prevention? When it comes to stroke prevention, diet plays a crucial role. A healthy diet can help reduce risk factors like high blood pressure, high cholesterol, and obesity. These conditions are major contributors to stroke. So, what are some practical diet tips to keep in mind? First, focus on increasing your intake of fresh fruits and vegetables. Aim for a variety of colors on your plate. These foods are rich in fiber, vitamins, and minerals, especially potassium. They also contain antioxidants that support vascular health and help lower blood pressure and cholesterol levels. Next, limit your consumption of saturated fats and cholesterol. This means cutting back on fatty meats, full-fat dairy products, and processed foods high in these fats. High levels of saturated fats can lead to atherosclerosis, which is a significant risk factor for ischemic stroke. Avoid trans fats as well. These unhealthy fats are often found in fried and processed foods. They raise bad cholesterol levels while lowering good cholesterol, which increases the risk of stroke. Another important tip is to reduce your sodium intake. Excess sodium can raise blood pressure, a leading risk factor for both ischemic and hemorrhagic strokes. To maintain a low-sodium diet, minimize processed foods and limit the amount of salt you add to your meals. When it comes to fats, choose healthy options. Unsaturated fats from sources like olive oil, avocados, and fatty fish can help reduce inflammation and improve cholesterol profiles. These fats are beneficial for heart health. Maintaining adequate vitamin D levels is also essential. Low vitamin D status has been linked to an increased risk of stroke. You can get vitamin D through your diet, sunlight exposure, or supplements as advised by a healthcare provider. Be mindful of added sugars and refined carbohydrates. These can contribute to obesity, diabetes, and metabolic syndrome, all of which increase stroke risk. Instead, focus on whole grains and natural sweeteners. Adopting established healthy dietary patterns can also make a difference. Diets like the Mediterranean diet and the dietary approaches to stop hypertension, also known as DASH, have been shown to significantly reduce stroke risk. These diets combine many of the principles we've discussed. In addition to dietary changes, maintaining a healthy body weight through a balanced diet and regular physical activity is crucial. Avoid excessive alcohol consumption, as it can raise blood pressure. Combining these dietary changes with other lifestyle modifications, such as quitting smoking and exercising regularly, can provide comprehensive stroke prevention. These dietary recommendations align with guidelines from major health authorities and reflected the current scientific consensus on stroke prevention. Always remember to consult with healthcare professionals for personalized advice, especially if you have specific medical conditions or risk factors.